I believe that what we've got is a system in the United States, and you know, it's interesting, people with mental illness are just one example of a disadvantaged population, but I think it's very instructive to think of what's happened to them. As the prison population has multiplied by 8 or 10 times where it was in the 1970s, actually the proportion with serious mental illness has risen at the same time. So we are doing a basically trans-institutional movement. We are deinstitutionalizing people with mental illness from our hospitals, which are closing down because we don't have any will to fund public mental health. And those people are getting into trouble and landing in jail and prison at an unprecedented rate, where they don't receive much good treatment. So what we've done is sort of re-institutionalize them, or the word in psychiatry is trans-institutionalization. There was deinstitutionalization in the 80s, and there's institutionalization in jails and prisons in the 90s and into the present. And so it's trans-institutionalization. Well, what have we done? And if you step back and look at that from a larger social perspective, we have a group of people who we as a society have decided not to take care of. We are not going to fund public mental health, supported living, low-income housing, vocational training. We have cut those things drastically over the last 30 years. At the same time, the incarceration group for the population that would benefit from the social safety net we've been destroying are going to prison. We are disappearing disadvantaged populations into prison. So then when you look at who's in prison, there are some rich people in prison. I can name most of them. There's about a dozen of them. And actually the rich people get a better situation usually in the federal prison in particular. But most people in prison are poor. Most people in prison are people of color. 50% of prisoners are African American. That's embarrassing. I mean, that is a reflection of slavery and racism and Jim Crow. Michelle Alexander's book is excellent on this point. The new Jim Crow. We're putting people in prison. Now, why are we putting them in prison? Look at the 2 decades before they went to prison. We cut welfare. We cut unemployment. We cut Section 8 housing. We cut public mental health. We cut public education. And then we stuck populations in prison to disappear them because in a democracy like the United States, we don't want to look at the gross inequity that we have. As the gap between rich and poor grows, and it's been growing by leaps and bounds, we want to disappear the evidence that we're an inequitable society. So we disappear people in prison. There are several functions of prison, legitimate functions that we talk about in our government textbooks. One is punishment. And under punishment, I include deterrence. So an argument for the death penalty, you know, there's a debate about this because the research actually shows it's not true. But one of the arguments is that it deters people from doing crimes. So that's punishment and deterrence. Then there's quarantine. There are some people who we don't want out on the street because they repeatedly do awful crimes. And then there's rehabilitation. Now, if you look through history at the proportion of which of those functions stands out in the prisons, it changes with time through history. Sometimes rehabilitation is more important than punishment. They both exist, but the rehabilitation is significant. The period between the 1890s and 1970s is generally called a period of reform in criminal justice. Awful things happened. People were, you know, there was tremendous racism, there were beatings by guards, there were awful holes which were dark and damp and that kind of thing. But on average, there was an attempt to do rehabilitation. The juvenile justice system blossomed. Since the 1970s, we've had a period of punishment taking charge. And rehabilitation has been essentially dismantled. The Supermax prison is just the symbol of that shift. So Supermax isolation is anti-rehabilitative. As I said, it causes the decimation of life skills. And what's happening is society is assigning prison the task of torturing the prisoners, torturing more and more of the prisoners, because still supermax confinement is a minority, but a significant minority. We're not talking about a few dozen people here. Pelican Bay State Prison has a SHU with 1,500 cells, as do other supermax facilities. There aren't 1,500 worst of the worst. I'm sorry, there aren't even 1,500 gang members in prison, or not of a level that would be dangerous to anybody. So something else is going on here, and it has to do with the destruction of rehabilitation. One of the most fundamental rules in psychology is that if you want to change behavior, it's much more effective to give rewards for the expected appropriate behavior than to punish the unacceptable behaviors. Much easier, much more effective to give rewards. As I've just described, in the supermax prison, there are no rewards. So the culture of punishment creates a ratcheting effect of worse and worse punishment, and then abuse, and then eventually torture. Meanwhile, the recidivism rate is climbing. I would think that would be embarrassing to us if we as a society paid attention to it. That is, our departments of correction are causing people to recidivate and end up back in prison. Something we're doing in the prisons isn't working. Maybe it has to do with the crowding, the dismantling of rehabilitation, and the turn towards solitary confinement. The other rate that's going up that's extremely stunning and upsetting is the parole revocation rate. That has gone sky high. By the way, there are rates going down. The proportion of prisoners who receive drug treatment is going way down. So you watch these statistics and you can see what's happening. As Dostoevsky said, you look at the prisons, you can see what's going on in the society. We do not believe in rehabilitation, we being the society. Then we have a problem. If you take someone, an average person with schizophrenia, who has a first break, usually we can predict it'll be in their late teens, early 20s. I would predict from my experience, which is tied to my age and when I practice, that in their 20s they will do illicit substances, often to treat the symptoms of their mental illness. They will non-comply with their mental health treatment, and then we will get a cycle. The person will go in the hospital because they're having a psychotic episode. We will get them stabilized on one kind of medication or another, antipsychotic, mood stabilizing, antidepressant. And then they will go out, and soon they will discontinue their medication, turn to street drugs, and be arrested by the police again and involuntarily committed or brought to the hospital by their parents. And this will happen 2 or 3 times in their early 20s. Then they will get it. They will say, oh, the reason I'm getting hit over the head by the police every 6 months is because I'm non-complying with my medications, I'm doing drugs, and then I'm behaving badly and the police arrest me. I'm going to do treatment. And maybe their parents get to them or whatever. I'm talking in sort of the average case. They settle down, and by the time they get to the 30s, they're not having psychotic episodes. That is, they recognize when something's coming on, they go to their psychiatrist, they take more medication. That's on average. We have a significant amount of research in psychiatry that the longer someone is left in an acutely psychotic state, the worse their prognosis. This is the rationale for immediate treatment. That is, you want to give someone antipsychotic medications. On a simple level, it might just be a training in acting bizarrely. That is, someone who's having a psychotic episode, hearing voices, acting in a strange way. You don't want them to do that too long so that that becomes a habit. Now with brain science, we're developing a more sophisticated look at that, and there are certain mechanisms in the brain that are reflected in the psychotic episode and that actually get made habitual in the brain because they last a longer time. In either case, let's compare the individual with schizophrenia. This is diagnosed by various clinicians, who at 19 has their first break. Parents keep them in the house, take them to competent mental health professionals, get them hospital, halfway house, vocational training, etc. They're going to do relatively well. Let's put that same person in the jail. First they become homeless, then they're in jail, then they get raped or beaten, then they go to solitary confinement. they're not going to do as well. I'm saying these things sort of in extremis in order to make the point. So what's happening is we're breeding with poor mental health care in the prisons and with supermax confinement. We're breeding a group of people who have worse mental illness, worse prognosis, worse disability, and become essentially untreatable. Say the individual has an 8 or 10-year term, and the term is up. What do we do? Well, not accidentally, the number of outside cases is going up. Do you know what an outside case is? Someone's in prison, and they either assault or throw something like bodily waste at a guard. In outside cases, they get charged with felony assault on an officer, taken to court in the little county where the prison is. The one around Tams probably has a very busy agenda. And they get a longer prison sentence. So now back to the person who's got an 8 or 10-year sentence. They go in with an 8 or 10-year sentence. They have psychotic episodes. They become psychotic in a chronic way, which is unremitting. And they start acting more and more bizarrely, and they get put in supermax. Now, what is the prison system going to do with them when they get out the other end? They have nothing to do, so what's going on more and more is that they get an outside case, which lengthens their time in prison, or most states are constructing civil commitment laws. That is, at the end of the prison sentence, the person can be civilly committed at a lot lower standard of evidence than we would be committed if we were acting strange in the community. And they go to a prison-like mental hospital indefinitely. So what I call this is hiding the evidence. I like to make little terms to describe these things which are shocking and constitute torture, I think. So what happens is we destroy the life course of the individual with serious mental illness. We make their prognosis very dire. We make their disability very large, and then we can't let them out because that would cause trouble. And besides, if a psychiatrist in the community receives someone who's just flagrantly psychotic out of the prison, they're going to say, what are they doing in that prison to make this person so psychotic? We don't want that, we as a society. So we do a civil commitment. We send them to a hospital where they're used to receiving people that the prison system has broken.